Hi, my name is Jani van Loghem. I'm an aesthetic physician and I'm working at UMA Clinic as the medical director. Lots of people come to see me because they're bothered by some folds in the middle of their face. And when I ask them what kind of results they would like to have, they usually start pulling on their cheek and their jawline. This is how I would like to have my results. So I inject fillers on the side of the face in order to put the soft tissue that has descended back to its original anatomic position, and that is a liquid facelift. A traditional facelift just pulls the skin, is basically two-dimensional, but a liquid facelift also gives volume back, and that makes it a three-dimensional and a more natural treatment. Everybody ages in their unique individual way. We just have to accept that fact and embrace it.